Hey there, everybody. I am going to talk today about the non-retractability of the foreskin. This is something that I actually get a lot of questions about, and so I figured that I ought to just do a response for those type of questions and clear up a couple of things. I guess the first thing I want to say is that I am not a doctor. I know a lot about certain things because I have researched it for so long, but nobody can diagnose a person over the internet. No one can know what's going on with anybody's penis without seeing it, assuming you are qualified to diagnose something. You would have to see it and have history and all of these types of things. So what I'm going to say is general information, and it is up to you to know whether or not what I'm saying is applicable, or what part of what I might say is applicable to your personal situation. Phimosis is a word that is used to describe the non-retractability of the foreskin, but that's really not enough for me. I don't like the fact that there's only one term that is basically applied to all non-retractability, and erroneously, at least here in the US, it's also used to describe the non-retractability of, say, a 3-year-old's foreskin, when that is a completely normal thing, and in fact that's a healthy thing. That's the way it's supposed to be. And they will even use this diagnosis of phimosis to encourage a circumcision, which is really inappropriate. I just want to make clear that phimosis is when there's a problem, when something has occurred in the past, or hormonal problems, or improper handling, or whatever it might be, has caused a change in the skin or a problem to occur that prevents retraction of the foreskin. So there's a difference between having a problem that prevents the non-retractability and just not having yet retracted your foreskin, or having a snug foreskin that doesn't come back, or even having a frenulum that's very short that prevents your foreskin from coming back. I am not going to give any sort of advice whatsoever about actual phimosis. If you're worried that there is a problem, definitely a professional is going to need to tell you that. However, in the U.S., we have cut them off and thrown them away for 100 years, so even medical textbooks show, here's a penis, and it'll be a circumcised penis, and there won't be any foreskin, as if that's the way they came out, when that's really not the case. So doctors are not learning about the foreskin. They're not learning about the problems that might arise. They're not learning anything other than cut them off when they're young, and that's kind of it. And then maybe as a secondary education, they cut them off when you're older. So we're really lacking in knowledge. So even though I say go to a doctor, that doesn't necessarily mean you should take the advice of the first doctor that you come across, given that he may not be educated. You may have to look around to get a doctor who knows what he's looking at when he looks at your non-retractile foreskin. So if the first thing that you hear out of his mouth is circumcision, then go get a second opinion. So plenty of young men have written and said that their foreskin doesn't come back, and oh gee, what do I do? So the first thing I want to say is that doesn't necessarily mean you have a problem, and there are actually problems that can come from the foreskin not being retractile. Not everyone who has a non-retractile foreskin will have a problem. You can live, and there are plenty of men in the world who live their full, healthy, happy lives with the foreskin never retracting, never having seen the head of their penis, and they're perfectly happy and healthy that way. there is in the literature a relationship between not being able to keep your penis clean and a risk for penile cancer, which is part of what all of the pro-circumcision nuts jump on in order to say circumcision prevents penile cancer. It doesn't, by the way. Plenty of circumcised men get penile cancer, but there is a relationship between hygiene and the risk involved. If you're okay with it not coming back and you are able to clean underneath your foreskin, in between the head and the glands, that you don't have any adhesions that for some reason have, that would be a problem that they hadn't released, and you are past puberty, if you can clean it and you can have sex comfortably and you can masturbate comfortably, there isn't any biological reason that you would need your foreskin to retract unless you just want it to, or if you're having a hard time keeping it clean. But a lot of men want their foreskin to come back because it's normal and that's what it does. If you have a normal healthy penis with normal healthy skin, then there isn't any reason why you can't gently, over a period of time, expand your skin to allow retraction. I actually, when my wisdom teeth first started coming in, I'd put my tongue back there and I'd be like, oh, what's going on, and my tongue barely reached the back of my current end of my teeth, just before my wisdom teeth. And in all the time that I was just daily just like reaching back there with my tongue, eventually by the time my wisdom teeth were fully in, my tongue could go all the way back to my wisdom teeth and even behind them. So I actually, over a few weeks, managed to stretch the frenulum that's under my tongue to allow my tongue to reach further back. So this is a natural, normal thing. It's a normal response of your skin to stretch with tension, and really it's not even stretching, it's expanding its length. So if you have a short frenulum on your foreskin, which is of course this band of connective tissue that's like under your lips and under your tongue, and there's one on your foreskin, and so some men, the reason they can't retract is because of their frenulum is tight. You can expand your frenulum. If it's the opening itself of the foreskin that needs to expand, that there's no reason why that can't happen. So this is something that you can do on your own, the way that some circumcised men are expanding their skin with tension to regrow a foreskin. Basically, it's just an attempt at retraction to the point where it's not uncomfortable, just a little bit of stretch over a period of days, weeks, depending on your situation, and that skin will respond to tension and expand. So it's not an emergency. The best time to do it, I think, is after a bath or shower when your skin is warm and moist. It will respond well to tension. But it's the kind of thing that you have to do knowing that you need to go slow. You don't want to tear. Some people like to use like an oil or something on their skin, like coconut oil is really great for your skin. And if you have not yet reached puberty, it's really not something that you should be worrying about just yet. Of course, like I said, mishandling can cause problems, but retractability of the foreskin is not something that you should expect at least until you're good and into puberty. So don't assume that there's a problem if you're young, and of course you should talk to your parents about it if you're that young. If you have been working on trying to retract your foreskin for a time, and you find that you're not having any progress, there are some steroid creams and such that a doctor can prescribe for you to help you along. So I think that's about all I've got. So thanks for watching.